Hi, and welcome to another Putnam County Library Lunch and Learn session. Today, we're going to be talking about Bladder Awareness Month, and we have with us Gina Galvez Filoteo. Sorry about that. But anyway, I'm going to turn it over to Gina, so go ahead.
Okay, I usually just set my timer in that way. We'll be right on track. So, I was trying to think of how to open this, okay, so I thought about a joke. Does anybody like jokes? Okay. So, one of my coworkers said, Gina, what if it doesn't work? You know, the therapy that you're doing doesn't work, okay? So I said, depends. No, but that's actually an original joke from one of my coworkers. So, like Miss Cynthia had said, my name is Gina Filoteo. I'm one of the physical therapists at the Regional Hospital. That's one of my disclosures. And I also have been a therapist for about 38 years. And yes, I started when I was 1 year old. Yeah. And over the last 17 with Cookville Regional, I spent about 12 years of that just focusing on the middle section right here, okay, and what we call the pelvic floor. And probably some of you don't even know where that is, but this is actually the area of the body that I deal with, you know, most of the time, okay? And this is the pelvis. As you can see, there's a hole there, okay, and it fits right here. And yes, men have pelvic floor as well, okay, except theirs is a little bit smaller, and with women it's a little bit, you know, larger, okay? And so the pelvic bone, as you can see, okay, there's a hole there, and what fills that hole are a group of muscles and connective tissues. The deepest layer of the pelvic floor that you're seeing right here is actually attached to the hip. It's a hip external rotator. It rotates the hip out that way. That's why some people who have total hip replacements, you know, or hip surgeries, sometimes they suffer from issues with leaking and things of that nature, but those are just temporary, okay? Once they strengthen the muscles, you know, the continence, usually they regain their continence. And the next layer, okay, is attached from the tailbone to the pubic bone. And the next layer is what we see all the way to the top, okay? People think this is just the pelvic floor, but there's deeper layers right there, okay? A good functioning pelvic floor means, okay, good contraction, closes the urethra in the front to prevent urinary leakage or stop, you know, leaking, and a good control at the back to stop poop from coming out, okay? So because we have a male, I'm gonna show you for the male, it's a smaller, you know, opening there, but they also do have that muscle. The external rotator of the hip, which lies deeper into the pelvic area, and then the next layer, all the way to the top, and this one right there, okay? And so they also have, you know, good contractions of the pelvic floor, closes the urethra in the front and the anus at the back, okay? And of course, directly above that, the prostate and the bladder. So with women, the pelvic floor supports the bladder in the front, the uterus in the middle, and the rectum in the back. If you have any questions, I mean, this is your class. Feel free to ask, you know, to ask me any questions. So these muscles are actually what we need to prevent urinary incontinence, okay? And on my way here, I just thought, I guess I better, you know, give some statistics. So I said, hey Siri, you know, how many women in the US have urinary incontinence, okay? And then it just tells me, you know, how it pulls up from a certain website that about 25% of women have urinary incontinence, okay, ages 14 to 75, okay? But they said that's not really a true percentage because some women, they go to the doctor and they don't even say that they have urinary incontinence. So that could actually be higher, Okay, so the statistics that they have out there, even with the Department of Health, could really be just a random figures of how many population that they ask, because some women, they're embarrassed, okay, to tell the doctor that they're leaking, okay. But the bladder awareness is actually it's a program. I'm also a member of the National Association for Continence, and they're raising bladder awareness that it's something that could be cured. Oh, sorry. I mean, Siri just answered a question for me. So, yeah. So, but anyway, urinary incontinence actually have a higher prevalence than what we think. And with men, it actually says 40%. 40% of men have urinary incontinence, but a lot of them have more the urgency incontinence. So we have three general types of urinary incontinence, okay? We have what we call stress incontinence, okay? It's not because it's under stress, but stress, your bladder is, stress. Stress incontinence is usually leaking with coughing and sneezing, okay? You don't have to raise your hands if you've, had that incident, or, okay, leaking whenever you're getting up from the chair, okay? Leaking with walking, or leaking when playing pickleball, okay? And so it's usually, leaking with activity, with physical activity. And then we have, so that's stress incontinence. Then we have the urge incontinence. The urge incontinence is, it's like a sensation that you gotta go. You always have that sensation that you gotta go, like strong urge to go to the bathroom, and as soon as you get up on the way to the bathroom, you start leaking, okay? There is even what they call the key in the key in the door, incontinence, where before you could even open, the door, like when you get home, you started leaking. And I have patients that actually would say that I have severe, urinary incontinence or urge incontinence, that by the time I get home, I pull the car right into the driveway. I could not even get out of the car, okay? And sometimes it just started, dripping on the way to the bathroom, and that's urge incontinence, okay? The other incontinence is what we call functional incontinence, okay? What it is that generally, as we age, okay, we lose some muscle strength, okay? But people that have, let's say, hip problems, difficulty with walking, difficulty getting up out of the bed, they do have control, they do have the sphincteric control, but it just takes them so long to walk to make it to the bathroom, okay? And so that's functional incontinence. And all of those three types of incontinence can be cured, okay? So pelvic floor therapy, that's what I do, is very, very effective. About 85, 95%, well, actually, some of my patients, they get 100% relief of the symptoms of urinary incontinence, okay? So, let's talk about common mistakes about urinary incontinence. And I have all my notes on my phone. So, okay, so we have top 5 common mistakes about urinary incontinence, okay? The first one that most people would tell me is that I don't drink as much water anymore, okay? I cut out drinking much water because the more I drink, the more I pee, okay? And so they withheld water, okay? So not because you're going to the bathroom too much, it doesn't mean that you have to quit drinking water, okay? Because water is not the culprit, okay? So drinking water calms the bladder. And you know what I teach a patient whenever they feel the urge to go to the bathroom? Is instead of getting up to go to the bathroom, is take a sip of water, contrary to what everybody would think, okay? Because you just need to take a deep breath, okay? And if you have to take you a sip of water, just take a sip of water, because sometimes it's not really a true urge that you gotta go. How many times have you felt the urge to go to the bathroom, okay? And you have the strong urge and you go to the bathroom, and then by the time you got there, only a few drops came out. It's not even worth it, a trip to go to the bathroom, you know? So, and those are the type of incontinence that's just like urge. It's more the urge, okay? So you're getting a false alarm, false, sensation, okay? And you're getting false information, your brain's getting false information that you gotta go to the bathroom, okay? So the next common mistake is thinking that it's all about Kegels and exercise. Okay, so you probably have heard some doctors when you say, "Hey doc, I leak a little bit. Oh, just do some Kegels, Kegels exercises." So you cannot exercise your way out of urinary incontinence. Okay, so pelvic floor therapy is very, very effective, but there's 3 factors to the success of the program. So the first one is diet modification, which I teach the patient on what not to eat, what to eat, what's good for the bladder, what's not good, and things like that. And exercise, that's number 2, and then of course behavioral modification. And I do have information on the table there for some common bladder irritants, what irritates the bladder, and that you could pick up later. And we'll talk about that too. So number 3 mistakes is that taking bladder pills, okay, to decrease the symptom, okay, is all that you need, because some doctors, if you go to the doctor, okay, because they really wanted to help you, they would just prescribe you a, medicine, okay, and they would say, take this. And there are some medications out there that is very, very effective, okay, in controlling the symptoms. But it's just the band-aid. It just stops the symptom, but it doesn't really help get to the bottom, of it, okay? So, and the effects of medications are just temporary. It's good while you're taking it. But if you quit taking it, then you're back. If you had not been through therapy. So some doctors would prescribe the medications, okay, just temporarily for, let's say, a month or 2, and then they would send them to me for therapy, okay? In that way, they could eventually win the patients, off of the medications and learn what they need to do. So, number 4 mistake is that I've had big babies, and so therefore I'm just gonna leak, okay? So, it's not really a part of being a mom. You may have a few instances of leaking right after, having the baby, because vaginal delivery is a trauma to the pelvic floor. But not because you have big babies, that doesn't mean that you would just be leaking. Nobody really should be leaking at all, period, okay? And nobody really should be expected to even go to the bathroom every hour on the hour. Okay? So, number 5 mistakes. I'm just getting too old, therefore I'm just going to leak. Okay? Well, leaking is not part of aging. It's not part of getting old. Okay? So, age does not have anything to do with it, because you could strengthen your pelvic floor at any time. Okay? And I've proven this many, many times. The first time I got into pelvic floor therapy, my very first patient was an 80-year-old lady, okay? And so I said, what is the doctor thinking? Or the doctor had already done everything that they could do for this patient, and so therefore I was the last resort, okay? So they sent me that patient, okay? So I told the patient that just really, according to the literature, age doesn't have anything to do with it, because it's all about muscles. You could actually strengthen, even at this point in time, you could strengthen your pelvic floor at any given time, okay? It's just like if you wanted to strengthen your arm and you want to be able to, pick up, some weights or something. You just started moving it, and then you pick up a small weight, and then you started, strengthening your muscles, and before you know it, you could actually pick up a 5-pound weight, things like that. So, with this lady, we work on exercises, we work on diet modification, exercise, and behavioral modification. Because sometimes we establish a bad habit. You feel the urge to go, you just go. And then, before you know it, you become a bathroom, frequent bathroom hopper, okay? And so she proved me wrong after about 4 or 6 visit. On her 6th visit, she was able to get rid of her diaper. Okay, so from wearing a diaper to wearing a pad to not wearing anything at all. Okay, and then I was telling Miss Cynthia this morning on my way here, actually I have patients this morning, and the first one that I saw, she couldn't wait to come see me because she said, Gina, even if, let's say today is our last day for therapy, you've changed my life, okay? Because at first she was not going to church because she's embarrassed, she might leave, she's, stopped going to social activities because of leaking. But since she said, now you gave me that control back, okay? Because now she could control the muscle. It's all about finding the muscle, what to exercise, and now she got better control. And she's actually not leaking anymore. She said, I wear the pad just in case, but it's really even, it's dry. And I said, then why you're using it, okay? So, and then the second patient that I've seen this morning is a gentleman, with a lot of urinary incontinence, going to the bathroom like 20 times. Well, I told him there's life outside the bathroom. And this morning he said, Gina, it's a good news, because he used to get up every hour on the hour at night to go to the bathroom. And then today, after 4th therapy session, he said, I woke up and it was 7 o'clock from the time I went to bed. And he said that was a big change, okay? So pelvic floor therapy works. Now, we were all born without the ability to control our bladder. True or false? Every baby's no bladder control whatsoever. We as a parent, okay, we help train their bladders, okay? We tell them, go to the bathroom before we sit down to eat. Go to the bathroom before we go to church. Go to the bathroom before we get in the car. We train their bladders, right? Okay? So, but by the time they started school, the teacher and the bell helped train their bladder. Every first grader, when the bell rang, they all line up to the bathroom. True or false?
True.
Every kid, okay, they have the same, bathroom schedule. They go to the bathroom when they wake up, and then by the time they go to school, everybody goes at the same time to the bathroom. Because the teacher can let them out just every little, whatever time, okay? What happens when we all started working? Our work schedule dictates our bathroom schedule, right? Okay, so you go to the bathroom before, you go to work. Then you would have a maybe 9:30, 10 o'clock break, you go to the bathroom. And then you have a lunch break, you go to the bathroom. And then you would go to the bathroom again, like in the evening before going on your drive, before you get in your car to go home, right? And maybe going to the bathroom again before going to bed. Is that correct?
Mm-hmm.
Okay. But what happens when we retire? What happens when we retire? So we stay at home, watch the television, okay, whatever program. If you're one of those that watch soap opera, one time I got hooked on Days of Our Lives. I watched those, and so. But do you know how many commercials there is in the on the program? And so they would have a commercial of like a Coca-Cola being poured on a ice, in a glass. And then you think, oh, I better go get something to drink, okay? And so then you went to the kitchen to go get you something to drink. But then you pass through the bathroom and you would say, I better go to the bathroom before I sit down to watch my show, okay? But then how many commercials are there in the show? Okay, a lot. And before you know it, you were going to the bathroom like every hour on the hour, okay? So you really become a bathroom hopper, a frequent bathroom hopper as far as that goes. And that's because of, the habit. It's not because your bladder actually can't handle it. So what's normal? Okay? On an average, a normal person goes to the bathroom 5 to 7 times. 8 is a magic number. 8 is borderline. Anything over 8 is considered overactive bladder. Okay? So I have had patients who actually go to the bathroom 20 to 40 times. Because I had them to do a diary. Yeah, I remember I had a gentleman who goes to the bathroom 40 times a day. And to the point that there are some people out there that, they would actually just live in the bathroom and watch a program there because they have to go to the bathroom. So, and it's terrible. That's why whenever they come to see me, they said it's life-changing. So, now, so 5 to 7 times, 8 is borderline, okay? Of course, in the summertime, when you drink a little bit more water, you may, go to the bathroom right there at 8. Okay, hold time of about 2 to 4 hours. It's a range, 2 to 4 hours, okay? So no one really is expected, or we don't expect, okay, anyone to go to the bathroom every hour on the hour, okay? You should be able to hold it at any age, 2 to 4 hours. Some people could hold it 5 hours. Some people could hold it 6 hours. But it's not really good to, hold it that long. There are sometimes occupation that you cannot really even go to the bathroom because of your job. So some teachers, we have what they call the teacher's bladder because they have to hold it because they can't, go to the bathroom right away. They have the nurse's bladder because especially with nurses that are like in surgery and they have to, be even the doctors who would operate on people for longer than 6 hours at a time, okay? And on an average, our bladder, okay, could hold about 16 to about 20 ounces, okay, of urine, all right? So you think about a venti cup, like in a Starbucks, if you order a venti at Starbucks, the 20 ounces. It could actually fill up that much cup of urine, and usually about the first pee of the morning. And in general, about 6 to 8 ounces whenever you go to the bathroom. But the first one every morning is usually like a larger amount. That's the physiological capacity of your bladder, okay? So 5 to 7 times, generally 2 to 4 hours hold time, okay? Now, we know the kidney is just nothing but a storage of urine, okay? The kidneys are the ones, the bladder is a storage, the kidneys are the ones that produces urine. So the kidneys produces urine about 1 to 2 ounces per hour, okay? So you can't really be going to the bathroom every hour on the hour. So why do you think you're having to go to the bathroom every hour on the hour?
Habit.
Okay, it could be habit, but it could also what you're putting in the body, okay? And that's why, you already pick up, the paper there, but at the back, we have a list of bladder irritants. And so there are some food that could irritate the bladder. And the first one, it says, yeah. Drinks with caffeine. Excuse me. So coffee, tea, soda, or chocolate. Chocolate, I love chocolate. Yeah, I do love chocolates. So, not because it's written here, that doesn't mean you can't have it. You could still have it. I mean, I drink some coffee and I love chocolates, okay? Sometimes I would put a hot cocoa into the coffee and just, double up all the caffeine, okay? But really it boils down to your bladder sensitivity, okay? Awareness is the key. I always tell that. I have a big sign on in the pelvic floor therapy room in our clinic that says awareness is the key. You got to be aware how your bladder is sensitive to, what your bladder is sensitive to. So I usually would have our patients to do a diary. You could make you up a little diary if you have any urinary issues. And just write down what you've been eating, what you're drinking, and see how it sends you to the bathroom, okay? So, because some of us may be able to tolerate a cup of coffee, but then by the time you hit 2 cups, that's the time it starts sending you more to the bathroom. So, and some medicines have caffeine in it. There's a list of medicines there that already have some caffeines. And also some stimulants, alcohol, liquor, beer, wine, and the use of tobacco are also irritants. And actually, cigarette smoking is linked to bladder cancer, just because the nicotine goes into your bloodstream. And there are foods, okay, that could be irritating. Artificial sweetener, milk products, citrus fruits and juices, tomato-based products, spicy food, sugar, honey, and corn syrup. And you're probably gonna say, now wait a minute, honey is supposed to be good for you, right? And so is fruits, okay, citrus fruits. Now, this is what I tell everybody, okay? The closer you are to the natural source of the food, the better it is for you, okay? So if you like tomatoes, eat a slice of tomatoes, okay, versus a canned tomato, okay? And because of all the other additives that they put in those processed food, okay? So if you like tea, you could have tea, okay? But instead of the sweetened tea, like the Milo's tea, I know those are really good, okay? You could brew your own tea in a tea bag. And herbal tea is usually, what I recommend if you like to drink tea. And like I said, you also see what your bladder sensitivity to it. Not because it affects you, that doesn't mean it would affect you. Okay? Now, any questions on that?
Gina,
Yes.
I've always understood that from past history that oftentimes men have to go to the bathroom all the time because they have an enlarged prostate.
Mhm.
Would you address that? Is that a myth or is that true?
Well, I mean, with the men, they have that internal sphincter muscle. The internal sphincter muscle directly right. If this is the bladder, there's the prostate with men. If it's enlarged, it could be putting pressure here, okay? And if that's not working, okay, if it's not releasing, then therefore they can't pee a good amount and they have more urine that stays there. Okay, therefore, if you have what they call a urine retention, wherein they have more urine that's staying there, then an hour later, you may have the need to go again, okay? And that's why, oftentimes you would see a urologist to help take care of that. But there's also some techniques, not because that muscle's not working there, that doesn't mean the outside muscles can be trained. Because you have these outside muscles for male. You have the pelvic floor muscles, okay? So, right there. Now, as you can see, the pelvic floor, I'm just using the female because it's larger. I could show you better, okay? The deepest layer, like I said, is a hip muscle, and the next layer there, and the next layer on top. What do you think is directly above that? Sits right here. The diaphragm, the breathing muscle, okay? So the pelvic floor is the floor, the diaphragm is the roof, okay? So breathing is very important, okay? So we're gonna do a little bit of breathing exercise, okay? So we know that the diaphragm is attached in the lower rib cage, okay? So we're gonna take a deep breath. Everyone just put your hands right here on your ribs. The lower rib cage, you can feel that because there's really like a gap right there, and then Okay, and so take a deep breath, expanding your rib cage like this when you take in air, okay? Imagine you got a balloon inside, and if you take a deep breath in, that rib cage is gonna open, okay? And if it's opening up, your belly is actually, becoming larger, okay? So, oops, sorry. That was my timer that, cues me. We're gonna need to wrap it up. All right, so take a deep breath, inhale, and then as you exhale, gently breathe out, and the belly actually will go down, okay? And the rib cage would close up like this, okay? And you could close your eyes, and you could feel that expansion of the rib cage. Inhale, make the rib expand, and as you exhale, just release that air. And if you're sitting, you would feel your pelvic floor, you're sitting on it, okay? You would feel a gentle movement up and down of the pelvic floor, okay? Because as your diaphragm contracts, okay, as you take a deep breath, the pelvic floor relaxes, and as you exhale, the pelvic floor contracts. So the pelvic floor muscles moves, it contracts, it lifts, it relaxes, and it bulges, okay? So it contracts, it lifts, it relaxes, it bulges, okay? Now, a good functioning pelvic floor also is able to relax, okay? So for some patients that have issues with constipation, okay, especially if they had not had a bowel movement for 2-3 days, the fecal matter could actually be pressing on the urethra, okay, preventing them to be able to pee out, and then they're having to go more frequently to the bathroom, okay? So managing the constipation is also important, okay? And another thing too, if your pelvic floor is the floor and your diaphragm is the roof, okay, and the two works together when you take deep breaths, if you reverse that breathing, or if you're breathing shallow, let's say you're breathing here. Some people, when you ask them to take a deep breath, they will do this. Okay, so they're breathing here, okay, instead of breathing here, okay? And that kind of confuses the pelvic floor, or the pelvic floor is not really knowing what to do, okay? So, but if you're breathing the right way, where you expand the rib cage as you inhale, and then it releases, it closes in as you exhale, the pelvic floor just moves up and down gently, like this, okay? And on people who are constipated, they're constantly holding it, okay, like that. And if you had not had a bowel movement 2-3 days, that could be pushing on the urethra, causing you to have the need to go to the bathroom more often than necessary. And it's actually been researched that people that have issues with urinary incontinence, especially urge incontinence, okay, and they have issues with constipation, once constipation is resolved, urinary incontinence is resolved as well, okay? So I have a list of food that actually helps stimulate some bowel movement for people who have issues, okay? And so there are food that thickens the stool. There are food that stimulates bowel movement. I'm very much into using food as medicine. So on this list, if you feel like you had not been having a good bowel movement, you may be consuming more of these, okay? So you need to add more of these on the right side, okay? So use food to help with regularity. So there are high fiber food lists at the back, okay? And if any of you are familiar with a squatting stool, I highly recommend that because it helps relax the pelvic floor, okay? And you've heard of, some commercials there about the squatting stool, and there's really a science behind it, okay? Walking is a good exercise, okay? And drinking at least half of your body weight in ounces of water, okay? They said we're supposed to drink 8 glasses of water for better health, okay? But that figure is just thrown out there because everybody thinks that most everybody is about my size, okay? But really it depends on your body composition. So if you're taller, you're bigger, you're more muscular, you're supposed to drink more. It's half of your body weight in ounces of water. And if you're not a regular water drinker, you don't have to just go cold turkey and let's say you're 180 pounds divided by 2, that's 90, and I'll be drinking 90 ounces of water. You know, you could, if you're not a regular water drinker and you only drink 6 glasses, maybe add another glass, okay, to that. And maybe the next week add another glass, and before you know it, you're right there at about 8 glasses. So you're right at 64, okay? And then sip throughout the day. So, because we're in the library, I thought, I usually would close my, my talk with top 5 things to do for a healthy bladder, okay? But because we're in the library, I thought of an ABC, okay? ABC, okay? So it's just easy to remember. A, okay? Awareness is the key, okay? Awareness, okay? There are lists of food and drink that they said could be irritating the bladder, okay? Write a diary, okay? And see what irritates you, okay? And make adjustments, okay? Knowing where the pelvic floor muscle is, okay? And how to contract those muscles also, okay? You know where the muscles are, how, you know, you squeeze like you're stopping the passing of gas or passing of urine, okay? And then you relax, okay? So, A for awareness, B for breathing, okay? Breathing is the king. Take a deep breath, expand that rib cage, okay? Because the pelvic floor relaxes when you do that, okay? And then when you exhale, okay, release that air and the pelvic floor moves up. Okay? And actually, if you're doing this at home, you would really feel the contraction of the pelvic floor with your eyes closed because it just moves up and down. It's a gentle move up and down. It's not a scream. It's not a scream, okay? Because I would say to my patients, if you're working your glutes, okay, you're activating your glutes or your buttocks, then you're overthinking it. It's just right there in the center, okay? So, A for awareness, B for breathing, and C, I have to think of this word. Actually, I just thought about it right before I came here. Constipation. Manage constipation, okay? People don't put that two and two together, you know, urinary incontinence and constipation, but this is the urethra where pee comes out, okay? Of course, that's the vaginal opening where baby came out there, okay? And here is the anus, right there. And the pelvic floor, okay, contracts both. When it's full, when it's working properly, it contracts, it squeezes and closes the urethra in the front and the anus at the back. So if it contracts it, it also relaxes it, right? Okay? So A for awareness, B for breathing, and C, manage constipation. Thank you very much. Do you have any questions? Any questions? No questions?
I
Yes.
do. I have a question. The chocolate,
Yes.
on one page it says it can loosen stool or stimulate a bowel movement. And I got all excited. Until you turn on the back side and it says it can cause bowel irritability. And I'm going, okay.
But remember, awareness is the key, okay? So, if what irritates you may not irritate somebody, okay? In the books, that's what they said according to research based on the people that they did the research on, okay? So what irritates you may not irritate another.
So we can
Person.
still have our chocolate.
Absolutely, absolutely, yes. And actually, I remember one time when I had a lady who came, and then I was just reviewing the irritants, and it says coffee. And she said, oh, I'm not giving up my coffee, okay? So she never came back. And so, but anyway, what I found out is because she's a school teacher, and she would have her Starbucks coffee right before she would give the lecture, okay? And she could never finish an hour lecture because she had to go to the bathroom, okay? And she could still have Starbucks, have it afterwards. So behavioral modification, okay? And another thing too is that it may not actually be the Starbucks. It may be lack of water. Okay? So I always utilize the rule of 2/3. Okay? So 1/3, it could be an irritant, so you could still have on all the good stuff there on the list. Okay? But 2/3 of what you put in your body should just be plain water. Because let's say if you're having a cup of coffee or tea, the only thing that your body is using up from that is the water from it, okay? And of course, because caffeine is a diuretic, it pulls fluid away from your body and make you go to the bathroom more often, okay? So awareness is the key, breathing is king, and manage constipation. ABC. Yeah. Any other question?
I had one. You were talking about, for a minute there, about when you pull into your garage, or you put the key in
Yes.
the door, or you're sitting watching your show and you suddenly think you need to go, but by the time you react to any of those things, you're already leaking. What do we do about that?
Okay, well, in therapy, there's actually what I call urgency suppression techniques, okay? So because, okay, if you're doing your diary and you know you haven't had any coffee or anything irritated, okay, in the last, hour or so, and you've just been drinking water. Let's say you've been really, serious about just drinking plain water, you cut back on the irritants and you're still having that, okay? Breathing, okay? Take some deep breaths with the, rib cage expanding. Helps calm the bladder. It calms the nervous system. Have you ever been to the doctor's office and you sit down and they check your blood pressure and your blood pressure was up? Okay, what do they do? What was the first thing that the nurse would tell you? Calm down, take few deep breaths. Because calming down and taking few deep breaths calms the nervous system, and in turn calms the bladder, okay? So, and knowing the facts, okay, let's say you have not had anything irritating, okay, and the bladder only produces 1 to 2 ounces of, urine per hour, and you've been to the bathroom like about an hour ago and you had a good amount, okay, so your body, your brain is getting false information. And a history of leaking may make you want to think that you need to go to the bathroom. Okay, and those are the things that I actually do with physical therapy, with pelvic floor therapy, is I teach the patient how to calm their bladder down if the issue is urgency, okay, behavioral modifications. In therapy, I also do what we call the biofeedback, where we put sensors, if any of you had EKGs, they put sensors along, the heart, and then you see it in the monitor. So in pelvic floor therapy, I use those sensors to put along the muscles of the pelvic floor, and you would be hooked up in the computer, and the patients would be fully clothed, okay? It would be hooked up in the computer, and then as they breathe and contract the muscles, they would see how the pelvic floor contracts and how it relaxes, okay? Because we deal with internal muscles, okay, the biofeedback helps you be able to see what your muscles are doing, and then you're gonna learn how to manage that internally, because you're seeing, oh, so this is how I do whenever it's contracting, and this is what I do when it's relaxing. So, because I mean, if I'm just looking at you and I would say, okay, contract your muscles, okay, and then relax. Take a deep breath, relax, and as you exhale, contract the muscles. I really wouldn't know if you're doing it correctly. And you really wouldn't know if you don't have an awareness, am I doing it correctly? But if you're hooked up to the, those electrodes, and then you're seeing it on the screen, you would learn. And then once you learn that one time, okay, you could actually go home and do your exercises, and if you close your eyes, you're actually gonna be able to visualize the contraction and the relaxation of the pelvic floor. And then you're gonna be able to manage your symptoms. So there is help. So it's not just medications. Any other questions?
Do they still do the transvaginal slings?
Oh, they do, yes, yeah. I've had patients who would have those. But most of the time now, insurance does not cover surgery without patients going for pelvic floor therapy first, because the OBGYN Association, Urology Association of Doctors pushes for pelvic floor therapy, and that's what I do. For first line before drugs, before surgery.
So that's changed because that was the first line with me. They wanted to do the sling. So
Yes.
that's what I got. I have a sling.
Yes, and then I have had patients that back in the days, they would just go ahead and do hysterectomy. You don't need it anymore, they just take it out. And then, or they would do the sling, but then I would see them later, years later, and they're back in the same issues. And so now, the most insurance and most doctors would send them for therapy first. In that way, I could teach them what they need to be doing or what they should not be doing, okay, before the surgery. Because another thing too is breath holding, okay? Remember, breathing is king, but diaphragmatic breathing, that excursion of the diaphragm and the expansion of the rib cage. And then if a patient is not able to do the right breathing, most of the time they're holding their breath. And when you're holding your breath, you're pushing down on the pelvic floor. That's why constipation, okay, is a big no-no. Okay, because when you're constipated, what do you usually do? Like that. So when you push down and you're chronically constipated and you're chronically pushing down on the pelvic floor, you're weakening it. So, yes, sir.
What advice do you have for stroke victims?
I mean, for stroke patients that actually have weakness of the pelvic floor, okay? Because if you have weakness of one side of the body, remember the deepest layer of the pelvic floor is a hip muscle, okay? So we strengthen the muscles that are weak. So we gotta be specific to what we strengthen. So there's specific sets of exercises that we teach on the patient to strengthen the hip muscles, thereby strengthening the pelvic floor. Because this is a hip muscle right here. And therefore, when you strengthen your hip, you strengthen the next layer, and then you strengthen the top layer. A simple exercises of moving the leg out, like so, like if you're sitting there, if you squeeze your pelvic floor muscle like you're stopping gas or pee, okay, and then opening the legs, just opening the legs like that, opening, yes, like that, yeah, opening the legs, okay, helps that. And then in therapy, we would wrap the band around the legs, for resistance, and we do the same thing to strengthen the hip muscles. So pretty much if you had gone through therapy after a stroke, the exercises that they taught you in therapy are similar exercises. You just gotta add pelvic floor contraction with that. Because what happens is that if you actually go for a therapy and let's say, I have hip pain, or had back pain or had stroke, they would teach you the basic exercises, basic exercises to strengthen. They would use the weights and things like that. So some therapists would incorporate some pelvic floor exercises with that, but not all of them. So in pelvic floor therapy, I specifically teach the patient awareness of the pelvic floor contraction first and breathing, because the two works together. So the pelvic floor muscle, yes.
I was going to say, if somebody's interested in pelvic floor therapy, do they need to usually go to their general practice doctor and ask for a referral, or?
Yes, because I work in a hospital, based therapy. We usually work under a doctor's supervision or under a doctor's order. And but any physician, PCP, primary care physician, nurse practitioner, midwives, you don't necessarily have to go to a specialist to get a referral for pelvic floor therapy. And all they have to do is to say physical therapy. It's physical therapy, okay, for, let's say, urinary incontinence, or physical therapy for the pelvic floor. So, and it's very, very effective.
And you operate out of Cookeville Regional Hospital?
At Cookeville Regional Hospital, and it's the outpatient building, the blue roof building.
I see.
So, and the treatment is done in a private treatment room. And the last I heard, I'm actually the only therapist that does that here in the Cookeville area.
You go, girl.
Yeah. So I think it's because a lot of the therapists, you have to have, let's say, a special skills. Not all therapists works with pelvic floor, and because after you graduate from physical therapy, you could treat neck, back, shoulders, hip, and all that. But in order to be able to treat the pelvic floor, you have to go for more postgraduate educations. And so not everybody, that's their area of expertise. Like some people want to specialize on the shoulder. Some therapists want to specialize on the neck or the back. So, yeah. Because whenever you're dealing with pelvic floor, then you have to deal with, some people that have issues with peeing and pooping. And of course, sexual dysfunction as well. So it's all part of the territory. So, and nobody really should be in pain. So if you have a pain that nobody, like you've been to all the doctors and they couldn't figure out, I have pain right here along this area. So, and that's basically, what the type of referrals that I would get. In addition to urinary incontinence and constipation and prolapse, like a prolapsed bladder, a prolapsed uterus, if the doctor thinks that, hey, this could be done with physical therapy, this could be resolved with physical therapy, we don't necessarily have to do surgery. And in most cases, really, most patients, they don't. Especially if it's still up there. It's just came down. But most actually women, young women, after vaginal delivery ended up with a first degree or second degree prolapse. Because, you're pushing a baby out. So, but that doesn't mean that you need surgery to put it back together.
Well, Gina, thank you so much for being with us. I'm going to end the recorded portion,
Sure.
But if after I finish that, if anybody else has another question, we can continue on. So thank you very much for being with us today, and we hope to see you in the future.